My name is Dina Katabi. I am the Andrew and Erna Viterbi Professor at MIT. And I'm going to tell you about our research in using radio signals to monitor COVID patients. COVID is a very contagious disease. And as a result, whenever healthcare workers, nurses, doctors trying to treat the patient, care for them, they are running the risk of catching the disease themselves whenever they come near the patient to get any measurement of their physiological signals. So what if we can monitor the physiological signals of all of these patients in their home even, remotely, provide this information to the doctors and without even touching the body of the patient? So this is exactly what we do in our research. We have invented a box that looks like your Wi-Fi box at home. It sits in the background of the home and uses the radio signals to extract breathing, heart rate, mobility, and sleep of the patient. All of that without touching the patient. And we can do this because radio signals, of course, are around all of us, and the radio signal that is around the patient get modulated by the physiological signals of the patient. So we analyze those radio signals using machine learning algorithms to extract heartbeat, breathing, etc. So let me show you an example. So here you see our sensor in the background. It's called the Emerald sensor. It analyzes, as we said, the wireless signals in the environment, as you see here. And from that, it can capture any motion of the subject. So here you see, for example, one of the people move. You see him as a blue dot and goes to the fridge. The other person also moves. But actually, it's very sensitive that it can capture even the inhale, exhale movements that are where the chest moves as a result of breathing. And when there are multiple people, it can zoom in on each person separately and extract their respiration signal, as well as their heartbeat, their mobility, their sleep, etc. So what we did is we used this device that we call the Emerald device to allow healthcare workers to monitor COVID patients without any body contact. And we remotely take this information and deliver it to the healthcare workers in their own homes so that they can keep an eye on the COVID patients recovering in their own homes. And this is very important because, as we know, during the recovery process, the patient's situation might degrade suddenly, and being able to detect that as early as possible can avoid having to rush the patient to the hospital, putting them on ventilators or oxygen. So let me show you some of the results. So here you see the respiration of a patient, and this is on April 7th. And you see the patient respiration rate is relatively high, 23 breaths per minute. But you see 4 days later on April 11, the respiration rate went to the normal level for this patient, which is 18 breaths per minute. Now, also mobility is another sign. And here you see the same patient on April 8 and April 11 as they are moving. So let's play this again and see how on April 11, the patient is much more agile and her movement are much faster. So these are good signs of recovery that we can capture and deliver to the doctors, but unfortunately, not all recovery stories are smooth. So let me show you this patient, and this is a respiration of a particular patient, COVID patient, and as you can see, the signal is very erratic, and the respiration, it does not have this nice up and down, but it's losing its width. And by monitoring this respiration and in the home continuously, we can actually detect whether some patients are having problems during their recovery. So here where you see, for example, each one of these curves, this blue curve, is the histogram of the respiration rate of the patient on one day. And so different histograms are for different days. So you can see, for example, for this patient, at the beginning, this peak of this histogram was moving and the respiration rate was decreasing, in fact, decreasing below 20 breaths per minute. But then suddenly, this is happening on April 14, as you can see, and the respiration rate went up significantly higher than 20 breaths per minute, and the patient ended up in the hospital. So the patient spent about 1 week in the hospital. She came back eventually. And again, we see that as she came back, her respiration rate is decreasing, and we can see eventually, in fact, she recovers smoothly. So what we can learn from and provide information to the doctors is that what allows them to differentiate between patients that are having issues with their recovery at home versus patients who have no problem. So let me show you this graph where we differentiate between different recovery process for the patients. So the first patient is the one that I showed you, which is the one that had a rehospitalization, and you can see the breathing actually jumps at some point and goes back. And then you can see other patients that we can capture also where their recovery process is smooth and their respiration rate is improving. And finally, you can see patients who are asymptomatic, they have no problem, they have no symptoms that show up on them, and that also is indicated by their respiration over time. So what we are able to do with this kind of technology is to provide a window to the home of every COVID patients and provide that window to the healthcare provider, the doctor or the nurse, so they can remotely and safely be able to attend to the patient and discover if there are any issues so that they can intervene before the patient ends up in the hospital. But not only this, in fact, increasingly, we are learning now that COVID doesn't end up just or end by becoming COVID negative. Many of the patients are continuing to have problems and continuing to show either neurological problems or kidney failures, etc. Or even like what we see also some mood disorders like depression and anxiety. So this technology allows us to continue actually helping patients after they recover from COVID, but by looking at the implication of COVID for the future health of those patients. Thank you.